Good afternoon, everyone, and thank you for joining us. My name is Jacqueline Donato, a Strategic Program Manager of the Queen's Chamber of Commerce. I am very proud to present today's webinar on safe and effective ways to return to work by Mobile Health and AFLAC. We will focus on how to adapt to the changing workplace environment during the COVID-19 pandemic. This webinar is also broadcast on Facebook Live and in Zoom, and is presented by Anthony Livecci from AFLAC and Andrew Shulman from MobileHealth. At this moment, I want to turn on to Anthony. Welcome, Anthony.
Hi, Jacqueline. Thank you. Thanks so much for having us. Good afternoon, Queen's Chamber. My name is Anthony Livecci. I own an AFLAC agency, and obviously I'm also a fellow Queen's Chamber member. I wanted to take this opportunity to share with the membership a strategic partnership that my agency has made in order to help business owners navigate safety and compliance issues brought on by the COVID-19 pandemic. Andrew Shulman is the CEO of a company called MobileHealth. We've worked with Andrew for many years and in many capacities. His organization is looked at as the top firm in the tri-state area to try to help businesses navigate through the changes that COVID has brought upon us. And without further ado, I'd love to introduce you to Andrew Shulman, CEO of MobileHealth.
Perfect. Thanks, Anthony, and thank you all for having us, inviting us to speak to you today. Let me see if I can start with sharing my screen. While I do that, I'm hoping that we can have kind of an open dialogue today. If you have any questions, feel free to put it in the chat. I know myself, I get hit up all the time for different webinars, and I end up minimizing them and hardly listening. So I'd love to make it as engaging and be able to answer your questions if you have any. So with that, I am going to share my screen, and hopefully that works. Can you guys, Jacqueline, does that work? You guys see the presentation?
Yes, it is. Yes, it's a very nice blue slide.
Perfect. Maybe we should just stop there. Quit while we're ahead. Perfect. So I'm going to tell you just a little bit about us. MobileHealth, we've been around for over 35 years. We provide employee screenings before people go to work and after. So we've got 7 clinics across New York City, one in Queens on Queens Boulevard in Rego Park, and then one in every borough except for Brooklyn, where we've got 2, and one out in Long Island. We see about 200,000 or so people a year and screen them to make sure that they are safe to go to work. The vast majority of our clients are also in healthcare. So pre-COVID, we do a lot of healthcare screenings for healthcare workers. So we check people to make sure that they're not bringing any type of communicable disease into the home, into a facility, and further putting a vulnerable population at risk. So as it relates to COVID, I like to say that we've been doing antibody testing before antibody testing was cool. This is kind of our area of expertise. When COVID first hit in March, the first thing that we were really focused on, like I said, a lot of our clients are in healthcare, was respirator fit testing. So we were called upon pretty immediately by organizations like FEMA and New York City Health and Hospitals to go in and make sure that employees, visitors, the front line were properly fitted to wear N95 masks. So we mobilized very quickly, and I think in 4 weeks probably did about 15 or 20,000 respirator fit tests. As that calmed down towards the end of April and people were safely outfitted with PPE, we started to look at what's next. And specifically for employers in the New York City area and nationally. And one of the things that came out of the sudden surge in need on the fit test side was we came out of those programs with stacks and stacks of paper of medical records that needed to be entered online and available quickly for our customers. And first thing I said as CEO of the organization was, whatever we do, it's got to be electronic. I'm not dealing with this. So we created a new system, a new technology that was meant to talk about bringing people back to the office or back to work. And we created a workflow that I'll talk through, but all very technology centric, and then started to explore COVID testing. So what I thought I would do is give you a brief overview of our system. A lot of the discussions that I'm having at this moment with organizations are centered around testing, around COVID testing and the options that exist. So I thought I'd spend a few minutes talking about that, and then open it up to anyone who might have questions. So there are three major components to the system that we put in place, and I'll get to each of them, but it starts with an online questionnaire. We call it symptom monitoring. Sure, a lot of people have done this at this point, where you're answering some questions to make sure you don't have any new risk factors before you enter into an office, followed by temperature screening, and then coupled with COVID testing. And while we originally created this service to be a kind of a full suite of services, we came to find out very quickly that organizations are at different points in reentry. Some are nowhere, and some have never stopped working. So we needed to create the system in a way that was a little bit more piecemeal. And if you just wanted to do questionnaires, that works. If you just want to do a mass COVID testing program, that works also. So just kind of talking it through very quickly. The system that we created for the online questionnaire or symptom monitoring, very simple. We send out a text message to individuals. We've created it in a way that can send questions to people based on their shift, or all sorts of different departments depending on how people are being brought back into the office. Questions are completely customizable. Nothing to download. You just get a text message, let's say every morning at 7 a.m. saying, hey, fill out your daily questions. The questions themselves are, these are kind of our canned ones. We can add whatever you want. So we're talking to people about, do you have anything new, basically since the last time we asked you, that would be a cause for concern. Do you have a new cough, any difficulty breathing, a new fever? Have you recently lost sense of taste or smell? Again, whatever a client wants to put in here with respect to questions, we can add that. And then once that is complete and people answer their questions, the system generates a QR code. If they fail, they get a big X. That's it. I hate the word fail, but if they answer the questions in a way that they should not enter any kind of public area, they get a very nice large X. We can customize the message that is displayed after with that X, call HR, get back in bed, whatever it is you want to say. And if they pass, they can either just get a pass, and we use that in instances where that's the end of the workflow. Or if a company has decided that they want to do some kind of front door screening, the individual who's answered those questions gets a QR code on their phone. That QR code they can save to their camera roll, to their images. They can then present to whomever might be at the front door doing the screenings. When it comes to the front door, we have been doing a lot of temperature screenings. We provide personnel, or you can use your own personnel. We can set clients up to just log in and they use their own They have individuals using their own technology, their own phone to scan that person's QR code, and they know right then and there that the person completed the questionnaire and answered it in a way that they should be allowed entry. Or we can set it up in a way that before person's allowed entry, scan the QR code, we enter in the temperature, and then they're allowed in. All of this data, and I'll show you briefly, is housed in a separate, secure, HIPAA-compliant medical record system. A lot of clients, when we first started talking about this, started to say, well, you know, I think I'm just going to use my own receptionist at the front door to do the temperature screenings. And you know, we don't give legal advice, but it's really important when implementing these kinds of programs to talk through any of the risk, not just the risk associated with putting your receptionist at the front door and by definition being less than 6 feet from the person they're taking their temperature from, right? You can't do a temperature 6 feet apart. But access to this information. Once you take someone's temperature, once you ask them questions related to their health, you have now crossed that line into medical information. And you need to be very deliberate and careful with who has access to that information. So we have a lot of clients who, yeah, they can put someone, they have the staff to put someone at the front door, but they choose not to simply because there's just too much risk associated with access to that information. And even beyond just the staffing piece, there is a lot of, you have to be careful with who has access to that information even after the fact. So when someone does answer a question incorrectly and should stay home, or someone does have a temperature at the front door, HR really should be the only one. Again, not a lawyer. Ask your legal team, but HR should really be the only one who has access to that information, or anyone who really has a need to know within your organization. Our workflow then goes to the next step and says, okay, what if that person has a temperature? Let's do a COVID test right then and there. So our staff comes on site with all the necessary equipment, the swabs, et cetera, and performs that required testing. Sends the person home, and now we've kind of closed that loop to make sure that the individual who showed up with the temperature is properly tested. I talk to a lot of companies and say you have to remember that we had temperatures before COVID. So people can come in, they could have a temperature and not be feeling well. It's not COVID related at all. The last thing you want to do is automatically send someone home for 2 weeks to quarantine, raise all the, an alarm when it was completely unwarranted. All of this is housed in a really pretty dashboard, real-time results of who's completed their questionnaires, who's answered them in a way that would allow them to come in, who answers them in a way that they should stay home, immediate alerts to HR saying so-and-so, you have someone has a temperature, log into your portal to see what's going on. No more paper. And a lot of self-service where you can change your questions, add employees, all that good stuff. So before I get into testing, I don't know if there were any questions, not yet. If you have any questions about any of that stuff, feel free to throw it in the chat. I'll move on to testing. So, like I mentioned, this is where we have spent a lot of time talking to companies in the past couple of weeks specifically. If you're familiar with what I think they call like the iron triangle or something like that, is typically when you're creating a new product, you look at the 3 areas. You can do things fast and cheap, and you sacrifice quality. but the three areas that you typically have to weigh are cost, speed, and quality. And it's the same thing with testing, except you have another variable associated with it now, and that's availability. So you might be able to get something that's cheap and fast, and even, you know, at a quality level that you want, but it might not be available. So there's kind of like, I guess it's we're moving to a square instead of from a triangle. So I'll go through some of the test options, explain them to everybody, and then we can talk through some of the pros and cons and how we're seeing them utilized. You've got PCR tests, antigen tests, and antibody tests. Those are the three tests. And then you break that down into what can be done at a lab and what can be done at the point of care, meaning we get a result right then and there while someone is while someone is in front of you. So PCR is the gold standard when you see on TV people doing drive-through events and the very long nasal swab that kind of scrapes the bottom of your brain. That is a PCR molecular test. A lot of this is the best test in terms of testing someone to see if they have COVID at the moment. So it's a snapshot to see if they are infected right now with COVID-19. There are two ways to get that sample tested. One is through a lab, and like I said, the other is at point of care. For the lab-based, if you're going to go down this route, it's critically important that you ask what the turnaround time is and get some guarantees and service level agreements associated with that. So a lot of the large labs, LabCorp, Quest, BioReference, they're taking days. We've seen with some of those guys 12 days on results. It's pointless. At that point, it's pointless. You know, you need to identify who's sick and get them quarantined, and then do the necessary tracing to figure out who might have been in contact with that person. And you want as short of a window as possible. We have just contracted with a new lab that is located down in Memphis. We ship our samples to them. They get the samples because they're in Memphis. They're like across the street from FedEx. So they get the samples around 1:30 or 2 a.m. in the morning. And they start testing immediately and have been getting us results about 12 hours after that. So we've been super happy with this group. There is something you might hear called pooling. Pooling is another great option. Pooling is when you take multiple PCR samples, combine them into one tube, and you test that tube. If that comes out negative, then all 5 samples that you put in there are negative. Only if it comes out positive does the lab then go back and test those 5. So that is a great option specifically for employers who want to do large numbers of tests and get the same quality that you would with any other PCR test. It tends to be significantly less expensive as well. There was an article, I think it was yesterday, that announced New York City has just opened its own lab, or is opening its own lab, specifically doing pooling. And the costs associated with those tests will be about 1/3 what they are with some of the bigger labs. So they expect to be up to capacity or be able to test like 40 or 50,000 samples a day within the next couple of weeks. This stuff changes every day. Literally, that was yesterday. And then you also have point of care options. So there are a handful, like 3 or 4 tests that are cleared under the Emergency Use Act by the FDA to do point of care PCR testing. Also a really good option. We are using that as, I'm going to get to the next test in a minute. We're using that as a, in many instances, as a confirmatory test for antigen testing, which I'll talk about. The reason we don't use that just across the board is you can only do about 2 or 3 an hour per piece of equipment. So if you're looking to do any kind of, I've got an event, or I've got 50, 60 people coming in every day, and one piece of equipment can do 2 or 3 an hour, it just, the logistics don't necessarily work. And to sit there and have 15, 20 machines set up tends to be cost prohibitive and just logistically very complicated. So that's where you get into antigen testing. Antigen testing is rapid, so it's a different kind of test. It's looking for the protein of the virus, and it has a much lower sensitivity than the PCR test. And what that means is you're going to get a higher rate of false negatives. So you're looking typically around an 84 to 87% sensitivity. So in theory, 16 to 17% of the people who test negative are not actually negative. This is a recommended test for your initial screening of asymptomatic healthy people. And what we've been working on with clients is saying, okay, this is a good pass through, right? It's not perfect. In all of this, what I tell clients is do not let perfect be the enemy of the good. 87% is much better than 0%. Doing something is better than doing nothing. So this has been a really popular option for companies. And then now that we're starting to see some availability of the point of care PCR testing, we're using that as, I mentioned the word confirmatory. If someone does have a positive antigen test, we're doing a secondary test right then and there with the PCR test that takes half an hour or so to get a true result. So on these machines, you can batch them and do 40, 50, 60 people an hour, very quickly. So this is a great option for quick and rapid testing. Jacqueline, someone had asked how often testing should be conducted. That's a great question. It is very much up to you. In an ideal world, you test every day, but it's cost prohibitive, right? So it comes back to what are you comfortable with? What we're seeing is one company we're working with, they are making COVID related equipment. They're testing their employees twice a week. That I think was the gold standard kind of set up. If you remember back in May, when nursing homes were, the ground zero, the nucleus for New York related COVID, that's what Cuomo recommended, twice a week for all nursing home staff. So I would say I haven't seen anything more frequent than that. We are working with a large school system, and they're doing what they're calling gateway testing. So they're doing PCR testing for all staff and students before they enter into the school. And then they're doing a percentage of the student body and staff every week thereafter, something like 5%. And they're just going to cycle through it to be able to get a sense if there's going to be an outbreak. I think that's a fantastic approach. But how often is definitely up to each individual organization and what kind of risk they want to take. The last test, and I won't even spend 2 minutes on it, I don't think, is antibody testing. Antibody testing was really popular for about 2 days. Antibody testing is great, and if you want to satisfy maybe your own personal curiosity as to whether or not you yourself has had COVID, but from an organizational perspective, I don't see anyone asking for mass antibody testing at this point, mostly because about 2 days after the lab started to offer it, the CDC came out and said about 50% of them are inaccurate. And then there's the point, the other piece of no one really knows, okay, if you have antibodies, how long is that potential immunity even good for? So there's, the jury is still out with respect to antibody testing. But I do anticipate as time goes on, this will be one of the pieces that we put in place. And again, as an organization that focuses, primarily on screening healthcare workers to go to work, and we do tens of thousands of measles and rubella and varicella titers or antibody tests every year to make sure no one's walking into a hospital with those diseases. I very much anticipate COVID antibody testing to be part of our testing menu down the road. But I think we've got time. I think that's going to be after a vaccine. The latest was, I think we're going to need that they're now saying maybe a vaccine and a booster. And probably not until, depending on who you listen to, but probably not until, somewhere into the middle to, third quarter of next year. So that's really kind of what we're up to. Happy to take any other questions related to testing or screening. My contact information is there on the screen if you have any specific questions or needs. Jacqueline, you want to close this out then? Jacqueline, you might be on mute.
Yes, give me one sec. I am checking on the Facebook Live, and also Amin has some questions on the chat. Amin, can you go with the question while I am looking for... Oh, he just posted. Amin posted 2 questions on the chat.
Perfect. I'm going to stop sharing my screen if I can figure out how to do that. Perfect. Availability factor. That's a great one. Sorry, I completely missed it. Which tests are most available? So the most available tests are lab-based PCR tests. So again, we have found better success working with small to medium-sized laboratories. The big guys are taking a very long time to process samples. So those are the most readily available, followed by, I would say the antigen tests are probably the next one, but they're all somewhat difficult to get at this point. We've, as a provider in this space, we've had to take a bunch of calculated risks associated with these tests. We've got probably, when they first came out, we probably bought about 20,000 antigen tests and have cassettes sitting. But now I can't get them anymore because the government came in and are providing them to a lot of the nursing homes. Abbott came out with another antigen test called the Binax Now that is marketed to be very inexpensive at like $5 each and requires no equipment. But they don't expect to have anything available till about November because HHS came in and bought the first 150 million of them. So PCR, I would say, is the most. Antigen would be second if you can find someone who has them. And then the third would be the point of care PCR tests. Slowly but surely, there was a new, every day, I'm kind of a loser, I refresh the FDA's emergency use authorization website to see what was authorized. So the latest was this week. Roche has a new point of care PCR test that will do both COVID and flu test in the same cassette. So that'll be, but everyone's taking time to ramp it up. And I think on the point of care side, they're focusing first on those who are symptomatic, as they should, and then focusing on asymptomatic screening people. So we've been lucky to be kind of at the forefront. We've got availability on all these things, but I don't expect it to last forever. And it's every day is something new. With different type of tests, better serve different types of business. And this is specifically to restaurants. You know, again, when you look at something like a restaurant, I don't know if I have not talked to any restaurants who are going to test patrons. We have what we've been doing. We've been really busy with a lot, and because it makes complete sense, a lot of one-off stuff. We've been doing movie shoots and film production. Like, we're going to do one event, we're going to come together, and then we're going away. We've been doing weddings, right? Like, we have a toned down wedding, and I'm going to have 20, 25 guests, and we want to test them. A lot of it's peace of mind, right? You want to show that you're doing something, even if it's not like the be all end all test. So I would say that you have to look at how frequently people are coming together. And the gold standard, again, is the PCR test. So if you can do that, and they're expensive. You could be at $200 a test. So it's really a balance of what works best for your situation. And if you want to test and give everyone some peace of mind, again, something is better than nothing. So when it comes to asymptomatic individuals, we're seeing a lot of the antigen testing as a really good entry point into testing for employers. Can you talk about the financial impact to business owners? I mean, I think I hit on that a little bit just now. It could be significant, to be honest. If you, when you're specifically when you're talking about testing, some of the stuff related to the other items like the daily symptom monitoring, that's pretty inexpensive. You can, you should be able to afford that without much issue. It's a couple bucks per employee per month. The testing is where it gets significant. Now, we get asked a lot about insurance, and there's been a lot of discussion about, yes, everyone's supposed to cover insurance, but a lot of those claims are submitted or covered when someone is symptomatic and is sick. There was not strong guidance given for screening tests. And what happens there is we can, for example, take insurance information, send it to the lab who's doing the testing. That's the most expensive piece of the puzzle. They then submit a claim to the health plan. If they get denied, that individual could wind up with a bill. And there have been a lot of articles, people with like $3,000, $10,000 bills, which is insane. Don't quite understand how that happened. I think a lot of that has to do with insurance companies' systems not yet being set up to process these claims and the codes associated with them. But like anything, it has to be weighed against the cost to not do it. Like I said, we're doing a lot of work for production companies in film. There are certain SAG requirements, Screen Actors Guild, that says you have to do PCR testing on individuals in a film shoot. And for them, the cost of doing 25, 50 tests is one that they have to be able to absorb in order to move forward with what they're trying to accomplish. And then, for many companies, it's what is the cost of not doing it, right? If we're not doing testing and we bring everyone together and we have an outbreak and then have to close for 2 weeks or longer, what are some of the costs associated with that. So the testing itself can run anywhere from, typically it's like $100 to $200 per person, depending on the kind of test. And then you talk about frequency. So those, those numbers can add up pretty fast. Same with, there was a question about the cost of social events. It's all about the same thing. So, the most expensive part is the test itself. Obviously there's labor component to it, but, yeah, you're typically looking around $100 on antigen, and depending on which PCR test, it could, the max I would say is around 200. Yeah, there was an article in the Times, I think a couple weeks ago, about Hampton's red carpet parties and them doing testing at like $500 a pop. As an entrepreneur, I wish I had thought of that, but I didn't. So we have to, I said to my staff, we have to move from providing scrubs to my employees to providing them with tuxedos. I never thought that was going to be a thing, but we're just kind of go with it, I guess. Any other questions? There's a question just about our history. We started in 1984, so we've been in the industry for a long time. We started off in a van going from, we service a lot of home care agencies. We screen home health aides every year to be able to go to work and stay on the job. So we started in a van going from home care agency to agency. My running joke is that at some point, it made more sense to build bricks and mortar, and stationary health didn't sound so good. So we kept the name, and at this point I either need to purchase another van or create an app, because people are constantly confused as to what we do. So we've, like I said, we've got 7 offices around New York City, 1 in each borough except for Brooklyn, where we've got 2. And then we've got about 1,200 urgent care centers that we partner with around the country to help us provide services when our clients have employees or candidates that are not located in the New York City region.
That is very impressive.
So that's it. I really want to thank.
I have another question.
Is there another question?
Yeah. It's because I am taking the questions from Facebook Live. That is why every time I write, I type, I put Facebook Live. Just give me 1 second, please.
Sure. Can testing programs be reasonably implemented into retail spaces? We have not had that many conversations with retail. I would say for the employees, yes, that's fairly simple to do. You can do pretty quick testing, 15-minute turnaround times, and not spend a ton of money. But I don't know if you're going to do testing on patrons coming into a retail space, and it's going to cost $75, $95. You better hope they purchase something, I would imagine. That's a very large customer acquisition cost. So for employees, yes. At this point, I think I would wait to find something that becomes more cost efficient in retail. I had mentioned that Abbott created this called the Binax Now. It's an antigen test, requires no equipment. It's pretty similar to a pregnancy test in terms of how it works. It's like called lateral flow. They're just not available yet. It's like anything, right? Like as soon as we have it, it's awesome. It's gonna be like the vaccine, really great. It's gonna take 6 months for it to have any widespread use or availability. So we're just not there yet. For the travel tourism industry, it's a great question on testing. It's important to make sure that there are certain states. I don't know for sure if Massachusetts still has it. I know that they did. They had a what they call the quarantine exemption. So for anyone traveling into Massachusetts from a list of states, they had a quarantine for 2 weeks unless they had a test. That test needs to be a PCR test or a molecular test, which is a PCR. Super important that if someone is going to one of those states and is traveling, that they ask the right question, and that they ask about turnaround time. I mentioned that we had at the beginning, we were with a larger lab, and we were getting 10-day turnaround times on PCR tests. Like I said, pointless. And we had an individual come in and got a PCR test just off the street. And she was doing it because she was supposed to fly to Dubai. And we didn't get the result back in time. Those results have to be good. 72 hours is the maximum window between when you get your test and when you can fly. And she came in and asked us to pay for her flight because she had to rebook it and get a new one because the PCR test took too long. We did not do that. She even went so far as to book another one and then get another test, and then I think also didn't get results back in time. So, you see some funny stuff. I'll tell you that much. But I think from a travel industry perspective, that's an important piece to take into account.
I mean, any other questions on the chat or?
No, nothing left.
Okay.
Okay.
So if anyone's interested in the slides or anything, I'm looking at the screen that I had up with my contact information and realized I spelled the URL wrong. So my email is ashulman, ASHULMAN @mobilehealth.net. If you have any questions after this that you would think of, happy to help.
Yes, thank you, Andrew. And definitely we can share your presentation and your contact information and Anthony information into to the participants and people who register to the event through our system at the Queen's Chamber of Commerce.
Thank you. Thank you so much for having me. I really, really appreciate it.
No, and thank you so much. This has been a class. It's very important because every day things are changing. I am very impressed that your company started years ago, and you are working at different, and you grow so big,
Thank you.
It's great. I know that there are questions and we have to wait. The city now is in the process to open a new stage. Restaurants are going to open on September 30th. Schools are going to go back, basically public schools on October 1st.
Yep. As of now, who knows what next week will come? I mean, that's a whole other webinar.
Exactly. Any final remarks, Andrew, Anthony?
No, thank you so much, Andrew. That was very informative. Appreciate it.
My pleasure. My pleasure. Thank you.
Thank you, Andrew.
All right. Take care, everyone.
All right.
Take care.
Bye.
Thank you, all the participants.